Hey guys, Woodruff here. So in my last video, I was talking about how I'm going to start re-recording my lectures. These are going to be a little bit different. These are new lectures. We have a new textbook, but also I'm including some, I call them interactive, even though this is like, an online lecture. There's not necessarily interaction where, like that, but it's like there's questions and other things that might take a pause for you as you're learning this content and help you to better understand the information. Anything that I give you here is really, there's content here, but it's also showing you how to study. So I'll also be inserting some tips and other things. So we left off talking about hypersensitivity, and we particularly focused on allergic rhinitis. But now what we're going to do is go into hypersensitivity reactions that can happen in other areas. So with allergic rhinitis, we're mostly talking about allergic reaction that's happening in the nasal area with that like itchy, watery, and like, the drainage and things like that. Now let's talk about other places we can have hypersensitivity reactions, specifically like local reactions on the skin, and then also on the face, like angioedema. So when we're talking about hypersensitivity on the skin, we're talking about like hives, contact dermatitis, and this is what most people think about when they think about an allergic reaction. It's usually a local skin reaction. Here, like something that's important to differentiate is usually with this type of reaction, the airway is not affected, like this person's not having any breathing difficulties, etc. The hallmark symptoms are going to be on the skin, and again, remember, hallmark symptoms, those are the ones you want to think about. These are a little bit similar to the other hypersensitivities we talked about with the itching, but again, the itching is going to be on the skin this time. Remember, for allergic rhinitis, the itching was in the eyes. Then they also can usually have a rash. They may also have swelling on their skin, just depending on how it manifests. Again, here, let's look at our priority nursing assessments. We're going to look at their skin, assess and document the rash. Especially we want to be seeing, is it getting better or is it getting worse? Sometimes with the rash tool, we'll even mark it with a marker to kind of show us, so that way, like as nurses are coming in, different nurses can see, is it spreading or is it staying in the same place? You always want to know where it is, how big it is. And then as you're documenting, you also have to document like what kind of rash it is, like, is it circular? Otherwise, I'm not going to get into the fancy turning terminology because I do not know it. Because that's one of those things that what you have to do often. And I'll be honest, I do not have to document rashes often. We also want to ask the patients what symptoms they are experiencing. Is it just the skin, or are they having any problems breathing? Because remember, when we're assessing a patient, we always want to make sure, are they having we want to know what they're experiencing. We also want to make sure it's not getting worse. You want to see if they're having any breathing difficulties, like they might say that they're feeling like their throat's a little bit sore, or it's a little difficult breathing. If they're having any problems breathing with movement, things like that, or activity, if they're having any sort of other reaction that's going on in their airway. Then we also, of course, want to figure out what's the cause, because with all things hypersensitivity, it comes down to what's really causing this to happen. So we're going to ask about any recent exposure to allergens, change to clothing, detergent, environment, things like that. So, moving on. How do we manage this? Usually we manage it medical management is like what medications or other treatments can we give? So we can try to do some lesser invasive medications and things. The least invasive would be, we want to decrease the reaction that they have. And this can also help to decrease their symptoms too, especially that symptom of itching, is to give antihistamines, which I talked about in my last video. If it's really severe, like if people have like a systemic rash, a reaction, sometimes they'll do topical or systemic steroids, which again, we'll talk more in depth about, I think, when we talk about anaphylaxis. If not, at some point here soon in respiratory stuff, we talk about steroids. So medications to decrease symptoms, again, those antihistamines can decrease, but something you're going to also see commonly used is what's called calamine lotion. If you've never, I know a lot of people that are young now these days have never had chicken pox, but when I was growing up, everyone had to experience chicken pox because there was not a vaccine. And so calamine lotion was something that was used for chicken pox, but it can also be used for allergic reaction. It's like an anti-itching. And so it's that antipruritic treatments is like an anti-itching treatment. Calamine lotion reaction really helps. So we used to take like calamine baths. It's like a pink lotiony substance and has a very distinct odor. But yeah, I remember when my mom went like into the cabinet and she was getting the calamine lotion out because I had chicken pox. Oh, it was so uncomfortable. But yes, luckily there are things to help. So we're going to give meds to decrease the reaction because again, we want to stop them from reacting, but we also want to treat their symptoms as well. The most important thing, of course, we can do is to figure out the cause, especially if they're still in contact with it. If it's something that's on their clothes, if there's a bug or other animal bee sting, other things, usually we want to get down to what is the cause. We want to remove any cause that is going on. We want to get a thorough history again. Maybe they need to keep a diary if we're really having trouble like figuring out what is it that they're reacting to. And then, of course, during an acute reaction, we want to remove the allergen or the trigger, especially, again, if it's something that's still, on them. All right, now this is an application check. So here's a multiple choice question. Let's get through this question first and read it together. So it says, a nurse is caring for a client taking diphenhydramine. So we have to remember what kind of medication is that. If you remember, what is that? That is, and people told me to give more of a pause here if you're wondering why I'm being dramatic, but you also could just pause me. There should be a pause button for this video, but diphenhydramine is a first-generation antihistamine. So they are taking a first-generation antihistamine for an allergic rash on their left arm, which finding indicates this medication has been effective. So this is one type of question that can be asked for a medication question. We can ask you a question, what is this medication? How do I know it worked? How do I know there's a problem with it? Right now it's asking, how do we know it's been effective? So it's pretty much, I need to think about what am I hoping that either one, a patient will tell me feels better after taking this medicine, or what can I assess for that shows this medication has worked in this patient? So we want to think that we're looking for what is good. We're looking for what is helpful for someone who is taking a antihistamine for an allergic rash. So let's go through these answer choices. So A says client reports decreased nasal secretions. Okay, well, I mean, less secretion sounds good, but they're here for an allergic rash on their left arm. So I'm gonna have to think about that one. Next one is client's pain has decreased from a 6 to a 3. Well, didn't say they were having any pain. Rashes usually don't cause pain. And diphenhydramine, I don't think it's used for pain, but I'll keep it on the back burner. And then the next one is client reports less itching to their left arm. Well, I mean, that sounds good. They're having an allergic reaction. They have an allergic rash, which usually causes itching. Diphenhydramine can be used for itching, so that sounds pretty good, but let's keep going. Client reports they feel sleepy after taking it. Well, with that one, I would think, like if they feel sleepy, as a whole, I mean, I'm expecting that to happen because that's a side effect, but that's not what I'm hoping for. And really, that's what you want to think about is which of these am I hoping for? I mean, some of these are good. I would hope they'd have less pain. I would hope they'd have less nasal secretions. I'm not hoping that they feel sleepy. That maybe is showing that the medication is effective in the sense that it's working, but you want to make sure in a question that it's asking, is the medication effective, that you're not just looking for, hey, are they having a side effect of the med? Like, for example, if a patient was taking a blood pressure medication and they started to have like the orthostatic hypotension where they're feeling dizzy. I mean, yeah, does that show the medication probably is in their system? Yes, but is that what I'm hoping? No. So we really want to think about what are we hoping to achieve? So I'm going to go ahead, test taking strategy. I'm going to cross out D because I'm not really hoping for them to be sleepy. I also don't think it has anything to do with pain. So I'm going to cross out B as well. So then I'm down to that they have decreased nasal secretions or they report less itching. So anytime I'm down to 2, I always go back to the question and I start to think about, okay, with this question, what is it really asking me? What's specific? And so they have an allergic rash on their left arm. So which of these is most specific to that? The only one that's really specific to that is C, because A, I mean, yeah, if they have less nasal secretions, maybe the diphenhydramine is working, but if they have an allergic rash on their left arm, is that what I'm trying to achieve? No. So the best answer here is going to be C, that they report less itching on their left arm. All right, so how do we know that it's getting better or getting worse? So if a patient that is having a a topical skin hypersensitivity reaction, they would be getting better if they had less of a rash or less of the symptoms like itching or less of the problems with the rash. And then we always want to make sure that they're not getting worse. So again, I have this on this slide now. I added this from the last kind of lectures and stuff that I did, because it's really important that we're always looking at, okay, what's showing that they're getting better or what's showing that they're getting worse. Because most test questions are either going to give you a scenario where it's like, hey, a patient is doing this, and you have to be able to understand, is that patient okay? That's expected, or is this a sign that I need to intervene or do something? We're really always looking for cues that a patient is okay or a patient is not okay, and I need to do something as the nurse. So then the second one says monitor to ensure they are not getting worse. So what do you call it? So they're getting worse if their rash is spreading. So if it's spreading to other areas of their body or getting bigger, if their symptoms are worsening. And then the biggest one here is going to be the respiratory symptoms. If they're starting to have airway symptoms, it's starting to become a systemic reaction versus a local reaction. So things I would look for is shortness of breath, increased work of breathing. So if they're using some of those accessory muscles, increased respiratory rate, if they're starting to have swelling in their face, mouth, lips, or other areas of their airway, or if their oxygen saturation is decreasing. So you always want to think about that, because you can look at these two and say, okay, what's the early signs? Well, probably the early signs are maybe their respiratory rate increasing, things like that, using some accessory muscles. If they're getting to the point where their oxygen is low, their airway is literally closing, things like that, I'm going to be pretty concerned. So always, if you have a long list like this, try to break it down, make it simple, or think, what could be my early ones versus my late ones? All right. So one thing that we do need to talk about when it comes to allergic reaction is there any way to diagnose allergic reactions? So one way to diagnose allergic reactions is what's called allergy skin testing. Because, sometimes, of course, allergen, like a person can have a reaction to something and maybe we're not able to catch what they're allergic to. So it really helps to have a way to be able to see what does a patient have that might potentially cause them to have, in other words, what might a patient be allergic to that could cause them to have like a more serious reaction? Because sometimes people have a mild reaction the first time, but it can come back and they can have a much serious reaction later. Effectively what we do allergy skin testing is to identify the allergens. And we usually do this also to see if we can maybe use what's called immunotherapy, which I'll talk about next. The thing to keep in mind with allergy skin testings is there are some people that cannot receive this type of testing. If someone has a severe reaction, like if someone had an anaphylactic reaction, I'm not going to be like, hey, let's go see what you're anaphylactically allergic to, and put a bunch of allergens on their skin and see which one causes their throat to close. Like, we're not going to do that. Or if someone has to around the clock be on allergy medication, steroids, anything that's going to suppress their immune system, or, like I said, like things like diphenhydramine or the corticosteroids, things like that, they have to be off all of that, because again, that's going to suppress my response. In this test, I am trying to see how someone responds to an allergen. If I'm taking a med that blocks my response to an allergen, I'm not going to get an accurate result. So they need to be off their meds, be able to tolerate being off their meds for this test. Anytime you're looking at a diagnostic test, you always want to think about, hey, what's my role as the nurse? It's like, a lot of times students study the deep, what is this test? How does it tell it? Blah, blah, blah. How does it work? But really you want to think of my role as the nurse. I have to do teaching before a lot of these tests to see, to tell the patient, what they're going to, need to do, if there's anything that they need to do before this test. Like some tests you have to be NPO, some tests, you might have to do something specific, avoid certain things. So for this test, the teaching, or my role as the nurse, is to teach the patient to hold all antihistamines, all allergy medicines, anything that's going to suppress my allergic response, etc. And so they'll need to go over that with their doctor and see what's safe. They shouldn't just stop those suddenly or on their own, but they should talk with their doctor if it's safe to stop those. We also want to know what this test entails. And, you really just need to know the basics. Am I going to be doing something as a nurse for this test? So how this test is going to go is they're going to actually be putting a dose of the allergen either on top of or under the skin to see if there's a reaction. So nursing considerations for this test are going to be that we never want to leave the patient alone. We're about to put something on their skin that we could not know that they're going to deathly react to it, or they could have a very serious reaction. So I can never leave them alone. In other words, after we do this patient has to stay in the doctor's office for a period of time. They cannot leave. We also need to be working somewhere that has epinephrine available because the patient could have severe reaction. We may need to emergently open their airway. We'll talk more about epinephrine soon. So this is kind of what an allergy skin test looks like. So this one on the left is what's called a patch test. And then this one on the right is an intradermal test. And you can see all of the red spots are a positive reaction, or like this person is reacting to whatever those things are. So pretty much what they do is they take a lot of common allergens, and again, they either on your skin or underneath your skin, the intradermal injections, like kind of like when you get a TB test, like it's like that kind of needle. What they're doing is that they're putting different allergens on, and they number them, and they know which one corresponds to each number, and they're seeing what you react to. So the scratch or intradermal, usually the reactions occur within 5 to 10 minutes, where the patch test is more of a looking for delayed reactions. These can take up to 48 to 72 hours. If there's no response to the allergen, the test is negative. So they have no allergy to those things. If there's a wheal and flare response, kind of like these, the test is positive, and the allergy is most likely present. Now, it's always possible that there could be a problem in administration or other things, and maybe it doesn't come back positive. So this is not a perfect test, but this is usually a pretty good likelihood that the patient has an allergy to these things. So then I talked about that a lot of times this can be used for what's called immunotherapy. So what is immunotherapy? So it is a treatment that allows, like pretty much what it is like, it's pretty much injecting the allergens that you are allergic to. They make a cocktail of them because most people are allergic to multiple things. They make a cocktail of them together and then start to inject them in small amounts into you to get you gradually desensitized to it. So, it's kind of like nursing school, how we gradually desensitize you to the pain of nursing school exams, how we give you so many application tests, questions in the beginning, and slowly like add more in, get you more used to them. Just a little humor for you there. In case for those that there's some people that don't always have a sense of humor, and I'm very sorry. I'm really full of crap. And so if you're someone who doesn't know me, just know that nothing I say usually is very serious, and I never mean to offend. I use humor as a defense mechanism, and I make really bad jokes. So you can always call me out. It won't hurt my feelings because I just am who I am. So, sometimes I love nursing students and I love what I do. I never want to cause anyone pain, but sometimes I make jokes because you guys can totally relate to the pain of nursing school, because it was not that long ago I was in nursing school. So just know, if I'm making any jokes about nursing students and the pain they go through, it's not me making fun of you. It's me commiserating with you. I'm sorry I have to be a part of your pain, but hopefully I make it a little better. It's always good to laugh. I have to laugh at my pain, because if I don't laugh at my pain, I'll lose my mind. So, effectively with immunotherapy, what we're doing here is that we're trying to, allow the body to get more used to these allergies and like form a different type of reaction, or stop reacting so much to it. It's very helpful for people who have an allergen they can't avoid. Like sometimes people do this if they live with someone who they're allergic to the pet, and so they can get desensitized because maybe they want to live and be with this person the rest of their life. It gives them the opportunity to. Now, it's not foolproof. It is not perfect, but it can lead to some improvement. We want to teach the patient, we can never fully desensitize them, but we can help improve their day-to-day symptoms. They still need to try to avoid that allergen whenever possible, because again, their body has already established this reaction. So pretty much they receive regular doses of the allergen, either biweekly or weekly. For when I did this with my husband, and he actually got them, I want to say it was daily or every other day. And we did it for a year, and I gave him the sub-Q injections. It's kind of like an insulin injection. It's a small little needle. He wouldn't agree. He thought I was purposely trying to hurt him, and that I was very mad at him all the time because I always seem to be injecting so fiercely. But I swear, I can only, those little needles, you can only inject so gently as you can. So sometimes the smaller needles are harder. But anyway, there's also a sublingual option where you can receive a daily dose of the allergen under the tongue. I'll tell you, I've never seen this before. It might be something that's becoming more common, popular, but usually you're going to see the subcutaneous injections. So the things to keep in mind, I always want to think about what I'm going to need to do as the nurse for this patient. There's a risk for a severe reaction with this treatment. So I need to always have emergency medication available and equipment available. So if they, sometimes like for me, they taught me, insurance allowed them to teach me how to give this therapy, to give this therapy to my husband, because I'm a nurse and easily teachable. And some people don't have someone in their house that can do that. Some people have to go to an office. So the office has to have the emergency medications and equipment, where for us at home, we had to have EpiPens at home and be taught how to use an EpiPen. Stuff that we also need to keep in mind is that as the dosages are increasing, there's increased risk for a reaction from these. So in other words, they're getting more and more of this allergen as time goes on. So they will be at an increased risk for a bigger reaction. So I need to teach them what the early signs of reaction are. And those are going to be, kind of itchy, sneezy, maybe having hives, throat swelling. These are all early symptoms where, the late symptoms, inability to breathe, stuff like that, we don't want it to get to that point. They can also have a local reaction to the injection itself. They might have redness and swelling at the injection site. This can be a sign that they may need a decreased dose. So they definitely should report if they're having any local reactions around their skin. Usually if they're in like a doctor's office, et cetera, they should be observed for 20 to 30 minutes after their dose. And if they're at home, they shouldn't be going out and driving like right after getting a dose, et cetera. They should be, doing something where they're not getting around moving, et cetera. If they're taking it home, the patient and the family will need education on what's expected. The local reactions can occur. The signs of a problem or a severe reaction, what those look like, and how to use an EpiPen. So, like with my husband, we did them at home, but then every so often we'd have to go in to get that bigger dose, or like the new dose that was going to be an increased dose. And then I would always have to demonstrate that I knew how to give it. They would watch me give it. We also always had to bring an EpiPen with us. So patients like that have this, like if they get a dose, they should always be carrying an EpiPen with them. They have one in the house. They should also have one while they're out and about, because they can have a reaction later. So education is for the patient and the family. They should always have at least 2 doses always available that are not expired. Check that expiration, because a lot of times we don't use these. There's a whole EpiPen crisis a couple of years back where these were getting so expensive it became like a black market deal. So make sure that they're not expired, because if they're expired, they may not work. This happens with insulin all the time too, where people hold on to insulin because it's expensive, but it's not actually working anymore because it's expired. So always keep it on with you. Keep it in a place where it won't be, extreme temperatures, stuff like that. Like I said, monitor those expiration dates. So this is not a medication you take prophylactically. This is a treatment medication, not a preventative. We take it, they take it if they're having difficulty breathing, if they're feeling tightness in their throat, or if they're feeling lightheaded, because that could be a sign of the shock and stuff like that from anaphylaxis. So it's not to take any time. It's not just to take like, hey, I'm going to take my epi so that I don't blah, blah, blah. We're taking this to treat an active problem where we think that, there's probably something going on with our airway that was kind of funny that my airway started to sound like it was closing when I was saying that, but it wasn't. But anyway, so it's really, we're taking at a time that we really have symptoms that are showing that we might be going into, having closure of our airway, et cetera. So those are some of the symptoms that we'll want to take it at that time. We're going to take it we're going to inject it at a 90-degree angle in our thigh and hold for 2 to 3 seconds. You can kind of see like in this picture. You can give it through fabric, but avoid it where there's really thick fabric. And then afterward, most students, don't really think about this, but you want to always think about, well, okay, after this med, this is an emergency med. Epi is an emergency med. So what are you going to do after? We're going to call 911, seek help, and know that they may need repeated doses. So in other words, you can't just take your EpiPen and be like, I'm good now, took my epi. They may need another dose, or we need to see, okay, if they could go into full anaphylaxis or anaphylactic shock. So we need to get help ASAP. All right, let's talk about hypersensitivity locally on the face, and then I'm going to stop the video, and on the next video I'll talk about just anaphylaxis. So hypersensitivity locally, like we just talked about, topical, like, like rashes, there's also what's called angioedema. So this is where they start to have, they have a reaction, just like all the other reactions we've already talked about with hypersensitivity, where the body is overreacting, and it's manifesting. All these particles are released, and these particles are leading me to, have, like, they can have the itchy symptoms, but I can also have swelling in places too. So especially like, this happens often when people are ingesting things or have things on their face that are causing a reaction. There can be swelling in their upper respiratory tract and face. This can be a little bit more dangerous because compared to the other reactions, this can actually lead to closure of my airway or inability to, oxygenate and ventilate the way that I need to. So the hallmark symptoms of angioedema are usually swelling of the face and the lips. And then, asking this question, what's the worst that could happen? Complete closure of my airway, inability to, be able to breathe at all. So here, our priority nursing assessments, it's going to be similar, that we're going to be looking, locally to those areas where there's the problem, the face, the upper airway. We want to look at the severity, characteristics of the swelling, how bad is it? But we really need to do a focus like respiratory breathing, airway patency assessment. Our airway patency is going to be the #1 priority here. So, how are they breathing? What's their respiratory rate, oxygen saturation, work of breathing? What are their lung sounds? You should be able to hear air moving in and out. And then again, same stuff, like what was their recent exposure? Do they try any new foods? Is there something new that they were exposed to that might have caused this? So of course, we know it's getting better if there's less swelling. But what we're going to be looking for is that their edema is worsening. And then again, that respiratory involvement is getting worse. They're having worsening shortness of breath, worsening, use of more of their accessory muscles, increased respiratory rate, oxygen saturation going down. Those are all signs that their respiratory system, it's getting worse. So what do you call it here? We're going to look at medical management. So with these patients, because of the swelling, a lot of times they need something a little stronger. We will a lot of times use antihistamines, but this time we're going to probably use IV. And that's because, again, like orally, some of these patients may have so much swelling they can't even swallow. So it's going to be a lot safer if we use IV antihistamines. And then these patients are probably going to need IV steroids as well, because of the amount of swelling and everything that is going on there. It's we really need to get that swelling down to protect their airway. So like I mentioned, nursing focus, it's all about airway. We're going to protect it. We're going to monitor it. They may need to be NPO depending on the location or degree of swelling. Like, if they have swelling in their other parts of their face, they may be fine to swallow. It's going to be a doctor decision. But just keep in mind, just because they're safe to swallow doesn't mean that you don't need to keep an eye on that. Keep their head of bed elevated to help with the swelling, and then help manage their symptoms, again, like giving things like antihistamines and the steroids to help to decrease the swelling, because that'll be the most uncomfortable part, is the swelling. All right, so before this will be the last part of this slide. So this is also this is kind of like a next generation kind of question. So for each of these, we're going to say whether it's expected or whether we would need to report it. So let's look at each of these. So this is something really good to do, is to practice like, okay, when are times that I'm going to need to call the doctor, and when are times that these things are going to be okay? So we have a patient with allergic rhinitis with yellow purulent drainage. So allergic rhinitis, they're supposed to have clear watery drainage, I think. So that doesn't sound too good. I don't think that that is expected for this patient. So for this first one with allergic rhinitis, if you're sitting there thinking about it, you want to think about, okay, they do have drainage, but what color is it supposed to be? Because sometimes this is how we get you, is that most people they read pretty quickly. So you always want to read carefully and be like, okay, what's it supposed to be like? So I would say we'd probably need to report this, because this could be a sign that they are, progressing to sinusitis. Let's read this next one. It says patient with angioedema with lip swelling. So we have to think about that. Okay, so patient with angioedema, we just talked about that. They're going to have maybe some swelling. So it doesn't say anything else. It doesn't say they're in any distress, anything's getting worse. It doesn't say worsening lip swelling, new lip swelling. It just says lip swelling. So for me, I'm going to probably say that this is expected, because there's nothing new or different. Those are the keywords you want to look for. They have a new or a worsening, etc. Patient with hypersensitivity skin reaction with an itchy rash to their left leg. So first I need to see, okay, this patient hypersensitivity, so it's that allergic reaction, it's a skin reaction. They have an itchy rash to their left leg. So then I have to think about, okay, well, what is a person like this supposed to have? Well, I think that they're having a skin reaction and they're having an itchy rash. So this seems like to make sense. And again, they're not getting worse. There's nothing that's changing or different. It's just that they have that itchy rash to their left leg. Okay. So patient with angioedema who is complaining of increasing shortness of breath. So what do you think the key word there is? So yeah, so looking at this one, angioedema, again, they might have some shortness of breath, but the key word here, the reason I would think that maybe this might be a time we want to report it is they're complaining of increasing. So they're increasing, worsening, more, like if they're having more or something is different, or any patient that's brand new, they're always going to, that's usually something that we're going to need to maybe do extra assessments or take more action. So I'm going to say for this one, we need to report it. Patient with hypersensitivity skin reaction. So again, an allergic reaction on their skin whose rash has spread from their extremities to across their chest and back. Well, it looks like, they had a rash, which is expected for hypersensitive skin reaction, but it's not expected for their rash to spread, especially not from just their extremities to all across their chest and their back. So it seems like this is getting worse. This will be another time we probably need to call the physician or report this. Patient with allergic rhinitis with tearing and frequent sneezing. So, sometimes you see that word frequent and you're like, ooh, that doesn't sound good. That sounds bad. Now, sometimes frequent is a bad word. When we talk about cardiac and we get into like premature ventricular contractions or PVCs, I don't like frequent PVCs. Occasional are okay. But when it comes to sneezing, are we thinking someone who's having allergies is going to have watery eyes, tearing, and frequent sneezing? Probably. Is there any life or death things that could happen from this? Probably not. Like I always think about with these kind of questions, if I'm going to have to call the doctor, what would they order? And it's not that, again, maybe if I don't have anything, I might need to call them, but is this life or death? I need to report this right now because something is unexpected? Probably not. So this is how you should look at these questions. Think about, is this expected or not? If I called the doctor, what would they order? Is there something that like they would be like, oh yes, we need to do this right now? Or is this probably something they're going to be like, okay, and like what else? So always try to keep that in mind. But anyway, hopefully that helped to get you started. That's a little bit more into hypersensitivity. And the next one, we will talk all about anaphylaxis. Hope you enjoyed this as much as I did. See you for the next one.